your program of choice, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to finding lasting solutions. I am your regular anchor, Ushuomowa Danis. Our focus for this week is looking at the impact of brain drain on medical doctors and the new concept of brain gain. Please don't go away. We'll be right back to discuss this after the news segment. In the news this week, according to a World Health Organization report of 2020, about 119,000 new cases and 81 deaths from cervical cancer occurred in Africa, accounting for 22.5% of global burden. The report also indicated that Nigeria, the most populous country in Africa, has one of the highest cervical cancer incidents and mortality rates in the continent, with an estimated 15,000 new cases and 10,000 deaths annually. It is to change this narrative and to save the lives of young girls from the ages of 9 and above that the HPV vaccination initiative was birthed by the federal government of Nigeria. As the vaccination exercise begins on the 24th of October 2023, the General Manager and Chief Executive Officer of the Nigeria Solidarity Support Fund, Dr. Fejiro Chinye Nwoko, is calling on Nigerians to embrace the initiative and take full advantage of the vaccination. Speaking during a virtual parley with journalists and news editors across Nigeria to deepen their understanding of the Fund's strategic initiative, Dr. Fejiro noted that the need to raise awareness about the HPV vaccine and its importance in preventing cervical cancer cannot be overemphasized. The Nigeria Solidarity Support Fund, NSSF, with the support of global citizens, is also unveiling its third We Naija Awareness to Action campaign under the leadership of Dr. Fejiro Chinye Nwoko. The campaign is geared towards mobilizing, inspiring, empowering and upskilling Nigeria's youthful population to participate in advocacy for a strengthened healthcare system in Nigeria, especially on issues that affect them and their community, like the HPV infection. Meanwhile, the National Agency for Food and Drug Administration and Control, NAFDAC, has approved the use of Gardasil vaccine as a single dose in the routine immunization against cervical cancer. In a joint statement by NAFDAC and the National Primary Healthcare Development Agency, data from immunogenicity trials, post-analysis of efficacy trials among females have demonstrated that a single dose of the HPV vaccine was sufficient to elicit an immune response that provides similar protection as a multi-dose regimen against initial and persistent HPV infection. Human papillomavirus infection, HPV, is caused by a DNA virus. It is the most common viral infection of the reproductive tract, leading to cancerous lesions that may progress into cancer. The virus is spread by men through sexual intercourse, hence the call for people to avoid multiple sexual partners. The 2023 World Sight Day recorded a lot of collaboration and activities by the Lagos State Ministry of Health, the Nigerian Optometrists Association, Lions International, and other non-governmental organizations to create the required awareness. Of all the activities and messages for people to love their sight, the message by the president of the Nigerian Optometrists Association about eyeglasses stood out.
The number one thing people need to know is that glasses have expiring dates. So when you buy something that has long expired at a very cheap price, you are not doing yourself any favor. You think you are buying it cheaper, but the damages that you are causing yourself are more costly than the gain that you have gotten from the profit that you made from buying it from the vendor. Then secondly, there is a lot of mischief makers, people that don't have any formal training, people that didn't have any form of education, just because they were watching either their father or their mother, and then they now start carrying glasses and tell you they can do it. When it comes to glasses, people feel that it is cheaper and better. I had a patient who told me the other day that even the one I got from the market, I am using it and I'm seeing better. I agreed with the person and said, okay, come to the clinic. By the time we tested this woman, what she was using is far, far from what she requires. Now, one thing about the eye that people don't understand is that the eye behaves like rubber. The more you draw it, the more it accepts. So if you go to the market and you're supposed to use a glasses that is 1, and then you carry 2, the eye will accept it. You put 3, the eye will accept it. But in the long run, you begin to suffer the consequences because you have stretched the eye muscles beyond what it's supposed to be. There are so many reasons that makes it difficult for you or not good for you to go to the market and buy your glasses. So in as much as I'm not trying to force anybody to do one thing or the other, but it is very, very important for you to have your first initial eye test with a doctor who can properly examine your eye and get you the appropriate prescription. Now, the other ignorance in the society is that people don't know that glasses are drugs. They are drugs, and it is like you are having malaria and you're taking ciprozine. Even the frame itself that you're buying, there's every need for you to know. It's not every human being that use every type of frame. There are some people that are allergic to certain types of frames that you buy. And then when you get the wrong one, maybe sometimes metal, sometimes the other one, they begin to react with your system. So you need the to be properly examined, all the parameters properly measured before you can now have a good pair of spectacles that you can call your own glasses.
Poultry farmers in Lagos State joined the rest of the world to mark the 2023 World Egg Day with a call on government to address the high cost of production.
The major problem we have now is scarcity of major ingredients we are using in making animal feeds, which are maize and soya. They are even nowhere to be found. And that is why we are here today. Even if you have your money, you can't get them. And there are many reasons for this. We've addressed all the reasons. One of them is the issue of banditry in the north. Majority of the maize farmers, they have run down to the south, making the ingredients to be more scarce.
They are closer because of the incident increase of our main ingredient, that is the feed, astronomically. And that does not relate to our profits. It's like we're even at a loss. Even the case of egg that is being sold outside, that's not the real price. But we just have to continue in business. As I speak to you, poultry farms have closed up. More are closing up as I speak. More want to close up. December is just here. I can assure you, after the sales of Christmas or New Year sales, some will not even come to it because they have really suffered.
Eggs are a vital aspect of human nutrition, but due to high cost of production, eggs have gone out of the reach of many. World Egg Day is celebrated 14th of October every year to promote the significance of eggs in human nutrition, food security, and overall well-being. Welcome back. A few weeks ago, there were reported cases of 3 doctors that died at the Alimosho General Hospital, another one at the Lagos University Teaching Hospital, Lut. All the reported cases were attributed to stress and burnout, resulting from increased workload on the few doctors left in the country. Let's listen to the Commissioner for Health, Professor Akin Abayomi, and other health experts on the situation.
Well, brain drain basically is people are leaving an environment and going to another environment that they feel they have more opportunities. So the brain drain phenomenon, as it works in Nigeria at the moment, it cuts across all specialties. People are just generally trying to leave the country because our economy is not very stable. And we know the number of reasons for that. But in the health sector, it seems as if the medical professionals have it easier because even countries abroad are looking for medical allied professionals, so it's easier for doctors and nurses and other allied medical professionals to move to other countries because those other countries are really attracting them like magnets. So our responsibility is, first of all, to improve the circumstances. We can't slow down brain drain dramatically, but we can increase our production. And what we are trying to do in Lagos is generate a phenomenon called brain gain. So it just becomes a complete cycle. So as doctors go out, acquire skills abroad, we hope that we can create the environment for them to come back to the country with those skills. So if that happens, then Lagos and Nigeria don't necessarily suffer extreme attrition, because when people go out, they don't go out and just sit down. They go out and acquire very, very advanced skills in different areas of medicine. And if they can bring those skills back to Nigeria, then we will be the benefactors, because many of those skills we can't even train people at the moment, because some of them are very advanced skills. So what we have to do is think. These people are going out in 5 or 10 years, they'll want to come back. Therefore, we have to create the environment and induce and create an attractive environment for Nigerians to come back home. 3 doctors died in a short period of time in Alimosho General Hospital. So we've set up a panel. They will almost finish the investigation. They'll give me the findings and I will discuss that with the governor. Generally, it's all part of the phenomenon. If doctors and nurses are going, then those that are left behind, if we can't replace them fast enough, then those that are left behind have a larger burden of work. And when you have a larger burden of work, then you become stressed and you become burnt out, which may exacerbate illness, or it may trigger illness, or it may exacerbate existing chronic illnesses. So we're looking at workload burden, we're looking at burnout, we're looking at environmental factors and seeing how we can soften the impact of excessive workload on our doctors and make sure that they look after their health. Doctors, generally speaking, they don't look after themselves because they're doing consultations all the time. They think they can treat themselves. We are saying, no, you must do the right thing. You must go and have a medical checkup frequently, especially if you're in a high burden work environment.
Very sad. I think because of the stretch of the brain drain and the pull and pull factors, a lot of our doctors in Lagos and all over the country are working over our stretch. They are burnout. They are working very, very hard, and because of that overworking stress, their underlying medical conditions are worse because they don't pay attention to their health again. That's why a lot of them die. So it's important we begin to down-tool work, and I've told them, government, if they would like to listen, that we don't have capacity to work in full frame anymore. We should explain to the public that right now we don't have capacity to do full services anymore. We should down tool. That's what people do. You can't have people do calls over the night and still work in the morning till about 4 p.m. every day again. It will stress on their health, and they will fall sick and they can die. So please, I appeal to the public to understand that the reason why we are alive is to treat them, but we must stay alive to be able to treat them. It's very, very important and very, very critical going forward. So they should help us see that what we're trying to do is to save our lives, to be able to save them. It's not strike, it's about reducing the amount of work we do regularly. If, for example, we see 200 patients every day at GOPD, we can tell them that now we can see only 80 patients because we only have 2 doctors to see those 400 patients, and the 2 doctors are stressed. So the efficiency of seeing them is important because of the health of the doctors also. So it's not about striking, it's about reducing the numbers or reducing the number of services we do regularly, because we're down to and the doctors' work, the work we're doing is a lot more than when we had more doctors to see the patients.
Human lives are not they are not abstract. Human lives are not sales of material commodity. So it is not available as luxury for doctor to say, okay, today I'm going to do just 4 hours and then go. What we are saying is that the demand for care, the demand to safeguard the health, the demand to safeguard the lives of the people are not optional demands. But what puts the pressure of long hours of doctors on doctors to practice is because the number of doctors on hand to do that are so few. So you find that shifts or duties or sessions that are supposed to be manned by, say, 4, 5, 10 doctors, 4, 5, 10 doctors are not available to man those duties. You run an outpatient clinic, for example, that witness clientele of, say, 150 to 200 patients. It's unlikely you are going to find in a government hospital they put a signboard in the gate that no, patient don't come, only 10 of you should enter. Where there were 10 doctors, 200 patients were coming. Now that those 10 have reduced to 2 because the remaining 8 have either emigrated or died. It is still going to be expected, if not by government employer, by the populace themselves, that they will still visit the same hospital, 200 of them, and they would expect to be seen. If they are not seen, is the general populace, is the citizens that will report to the MD, report to the governor, report to the commissioner, we go to so general hospital, no doctor to see us. So we're saying that rather than scrape the problem on the surface, we address the root causes. You cannot be in control of who falls sick and who needs help. We're saying that the number of doctors incentivized, made available to take care of these sick people is in the purview of the government who employs them. It's not only employment, in making environment conducive for those they have employed to stay back in those job stations and make life livable for them also, so they will be enabled to dispense of the sacred duty of human health and human lives. So part of the demand is not in cutting, because if you cut down on the so-called work hours, what time of the day do you shut down a tertiary institution? So LASUS should work, say for, you say 8 to 4, and LASUS should shut down? No, this is not practical. So we're saying that whereas you can't control those factors, you should pay attention to the factors that you can control, that you can address, and address them now as a matter of emergency. We do not have the luxury of long discussions, long bureaucracy of want to do this, want to do that. That's why part of the demand of Medical Guild is that a practical state of emergency be declared in the health sector, because we are confronting, an emergency situation on our hands. The conditions surrounding the demise of a number of my colleagues, including the ones that you have mentioned, any death, doctor or not, is sad news to their colleagues, members of their family. The Medical Guild already had put together a comprehensive document that identified, highlighted the areas where we believed from our investigations and findings that the challenges to human resources in the health sector, the challenges to the practice of healthcare in this state are emanating from.
If you are just joining us, it's Health Affair on AIT, and next on the program is our nutrition segment, an aspect of the show that focuses on eating right to stay healthy.
It's a common saying that you are what you eat. This is why we make it a point of duty to give you information about food items, fruits, and their nutritional value to help you make healthy choices.
Carrot was originally cultivated for its leaves and seeds. Carrot is a nutrient-dense root rich in antioxidants, fiber, beta-carotene, other vitamins and minerals. Consumption of carrots is good for vision, promotes hair growth, weight loss, regulates blood pressure, lowers cholesterol levels, and helps eliminate toxins from the liver.
Join us on our clinical segment for tips on healthy living.
The food that one takes, it determines what goes on in the body. If you take natural food, organic food without chemicals, food that have not been preserved, that are not dead food, we're talking about living food now, it helps your body to stay out of cancer, because your body is a living cells. If you are now putting preserved food, inorganic food into it, it's like putting dead food into a living body. So we now recommend for parents, they should give their children real food, organic food, living food.
On our perception segment, we appreciate your contributions on how to improve human lives and the nation's critical infrastructure. To be a part of this segment, you can call the numbers showing on your screen.
At this age and time, when women are out there doing a lot of things, then you still see fathers, most especially, coming to tell you that, no, she's a girl, I can't invest my money. I think we need to change our mentality. And when we want to talk about the future of these girls, I feel personally that we need to give our girls and our women chance. We have limited the female gender too much.
Thanks for spending your time with us. Let's do it again same time next week. I remain yours truly, Ushuomowa Daniels. Please endeavor to advertise your health products and services with us.